Nursing antibiotic resistance with 3 NCLEX style questions. Resistance occurs when pathogenic organisms change in ways that decrease the ability of a drug or a family of drugs to treat disease. Common examples of emerging strains of antibiotic-resistant organisms are MRSA, VRE, and VRSA. MRSA, methicillin-resistant S. aureus, often causes skin infections. In some cases, it causes pneumonia and other infections. VRE, vancomycin-resistant enterococci, are bacteria or germs that are normally present in the human intestines and in the female genital tract. VRSA, vancomycin-resistant Staphylococcus aureus, a commonly used staph bacteria that is resistant to the antimicrobial agent vancomycin. Vancomycin is a commonly used medicine used to treat staph infections. Staph are commonly found on the skin and in the nose of healthy people. Patients can contribute to resistance development by 1. Skipping doses. 2. Not taking antibiotics for full duration of prescribed therapy. Or 3. Saving unused antibiotics, thinking, in case I need them later. Remember, 1. Only take antibiotics prescribed for you. This decreases your risk for developing resistant infection. 2. Wash your hands frequently. Hand washing is the single most important thing you can do to prevent infection. 3. Follow directions when taking antibiotics. Not taking your antibiotics as prescribed or skipping doses can allow antibiotic-resistant bacteria to develop. 4. Do not request an antibiotic for flu or colds. If your healthcare provider says that you do not need an antibiotic, chances are you don't. Antibiotics are effective against bacterial infections, not viruses, which cause colds and flu. 5. Finish your antibiotic. If you stop taking your antibiotic early, the hardest bacteria survive and multiply. 6. Do not take leftover antibiotics. Although antibiotics are a class of drugs that we typically think of when discussing drug-resistant organisms, any organism, whether virus, fungi, or parasite, can develop drug resistance to agents typically used to treat them. Hence, we now use the term antimicrobial resistance to describe the phenomena of resistance against different classes of organisms. Our NCLEX style question states, a patient was recently diagnosed with a sinus infection and prescribed a 10-day course of an antibiotic. After 3 days, the patient felt back to normal and informed the nurse that he decided to stop the antibiotics and save the rest of the antibiotics in case he gets another infection. Which statement by the nurse would be correct in providing education to the patient? A. You should keep the leftover antibiotics in a cool, dry place so they do not expire. B. It's okay to save the antibiotics for the next time, but you should check the expiration date. C. If you have leftover antibiotics, please return them back to the clinic so we can give them to patients who cannot afford their medication. D. If you are prescribed antibiotics, you should complete the entire course of treatment because you may create drug resistance by stopping early. The answer is D. If you are prescribed antibiotics, you should complete the entire course of treatment because you may create drug resistance by stopping early. The nurse is teaching a group of young adults who live in a dormitory about the prevention of antibiotic-resistant infections. What should be included in the teaching plans? A. Save leftover antibiotics for future uses. B. Hand washing can prevent many infections. C. Antibiotics are indicated for preventing most colds. D. Stop taking prescribed antibiotics when symptoms improve. The answer is B. Hand washing can prevent many infections. What should the nurse teach the patients in the assisted living facility to decrease the risk for antibiotic-resistant infection? Select all that apply. A. Wash hands frequently. B. Take antibiotics as prescribed. C. Take the antibiotic until it is gone. D. Take antibiotics to prevent illnesses like colds. E. Save leftover antibiotics to take if needed later. The answers are A. Wash hands frequently. B. Take antibiotics as prescribed. And C. Take the antibiotic until it is gone. If this content was helpful, please like this video and subscribe, ring the notification bell so that you'll be notified for new videos. Once again, thanks for watching.